Okay, I'm Mary Argent-Catwaller, and I'm representing Group 1, a great group, lots of diverse experience and opinions. Like the other groups before us, we also talked about integration of systems and embracing innovation. Something else we thought of was using data as a driver for making decisions. As our speakers pointed out, there's a wealth of data out there. As long as you have good, clean, well-maintained data sets, you should be able to use that as a driver, and having the relevancy of the different aspects of the patient's condition in front of the physician. One sort of thorny issue we addressed was the arrogance of some surgeons and medics. I don't want to offend anyone here who might be part of those professions, but if there could be, I think one of the themes from the speakers, Dion particularly said, if you can reduce it to a mathematical equation, you can solve it. But then she also said, but some of the great ideas haven't been taken on board because people sort of like to do things the way they do things. And we think this is particularly a problem of some of the arrogant healthcare providers, and maybe some kind of accountability where there are penalties if they don't implement the best practices or the recommendations. Again, I think this is sort of the medic's mindset of always going with the empirical approach rather than perhaps the rational engineer's approach. So you've got the clash of these two schools of thought, I guess. Also, empowering patients is really important. One of the people in our group is part of a patient advocacy group, and he pointed out that they're not often invited to some of the key conferences and meetings of some of the big healthcare providers in the region, which seems a bit of a strange thing not to make them part of that dialogue, especially as patients can be so much more informed about their health these days with the internet and various tools. So empowering and educating patients is really important. And also, one of our group works in a hospital, has worked with several hospitals, I should say, and he, sort of carrying on from what Carolyn was presenting about with barriers to treatment, he gave the very simple example of, patients having to think about parking, and, maybe they have to sort of take up valuable healthcare staff time just sort of phoning up to say, well, where do I park? How do I get to the building? If I'm going for treatment, do I have time to go to the bathroom? All these kind of simple things, which, again, if you just sort of gave the information and maybe an FAQ or something like that, it would just sort of free up staff time to do the stuff that really matters. And I think, is that everything we came up with, guys? Okay, great, thanks.